Brown syndrome is characterized by a mechanical limitation of elevation in adduction. This disorder was originally described by Brown in 1950. Hence, it was called superior oblique tendon sheath syndrome. Disorder is caused by a restriction related to the superior oblique tendon or the trochlea. The forced adduction test is a must for the diagnosis of Brown syndrome. If the forced adduction test is positive, this means a restrictive pathology. It may be Brown syndrome, blowout fracture, or endocrine myopathy. In Brown syndrome, the elevation is severely restricted in adduction. There is less severe or no restriction on elevation from primary position and in abduction. In blowout fracture, restriction of elevation is usually not limited to adduction, but exceptions may occur. In endocrine myopathy, elevation is limited from all gaze. If the forced adduction test is negative, this indicates the presence of inferior oblique paralysis, which is a very rare condition. Brown syndrome may be congenital, acquired, or iatrogenic Brown. Most cases of congenital Brown syndrome are caused by thickening or tightening of the superior oblique tendon. Abnormal fibrous attachments to the globe that prevent elevation in adduction have also been described. And sometimes surgical exploration of the superior oblique tendon reveals no obvious abnormalities. In congenital Brown syndrome, usually there is no abnormal head posture, and usually the eyes are orthotropic. In this case, no surgery is indicated. A compensatory head posture to avoid vertical diplopia may develop in many patients with Brown syndrome. This usually consists of a variable head tilt and chin elevation that places the involved eye in a position of abduction and depression. Only in these cases, surgery is performed to normalize the head posture. Superior oblique tenectomy is the most effective procedure in the treatment of Brown syndrome. However, an iatrogenic superior oblique palsy develops. Acquired Brown syndrome may be traumatic due to trauma to the trochlea or due to inflammatory process in the region of the trochlea. In cases of traumatic cases, exploration of the trochlea must be done and relieve the restrictions, while in inflammatory cases, usually injection of local steroids may improve the condition. Iatrogenic Brown occurs when an excessive tuck of the superior oblique tendon was done. In most instances, the surgical complication resolves with time. However, in some patients, this limitation persists and causes diplopia in up gaze, in which case the tuck may be taken down surgically.